Thank you so much for your time today, Dr. Gonçalo. Really, really good to see you. Could you just start by giving us a bit of a background about who you are, your training, your experience, where you was working before and where you're working now?
Absolutely. Thank you for having me, Emily. It's an absolute pleasure to be here talking to you, and especially to be here living in the UAE at the moment. So my name is Gonçalo Ferreira. I'm a nuclear medicine physician working presently in Burjeel Cancer Institute in Abu Dhabi. Previously, I was working in the Portuguese Institute of Oncology in Porto, doing my specialty, which is nuclear medicine. So I graduated in 2014. Shortly after I initiated my training in nuclear medicine, I ended my specialty in 2020, and back in 2024, I started about moving because I was getting a bit frustrated with the lack of progress opportunities back in Portugal. And that's when I contacted you guys at Allocation Assist. And at the time, you guys told me that it was, hard to come here to the UAE with less than 5 years of experience. But fortunately, sometime after that, this opportunity came.
Yes.
And it was really a perfect opportunity for me.
Yes.
Because, as I just said, I was also working in the Portuguese Institute of Oncology. So my expertise, it's in oncology, it's nuclear medicine, but mostly directed towards oncology. And so this was a great opportunity. It just aligned with my expertise. They were looking for someone who specialized in theranostics, in therapy, in nuclear medicine. We can talk about that a bit later. So it was a great opportunity, and I'm very glad that I came.
Amazing. Because nuclear medicine is mainly for oncology, isn't it? But I think it's like a growing specialty, but your main background is the oncology.
Yes. So nuclear medicine is a specialty that basically uses radiopharmaceuticals. So radiopharmaceuticals are our bread and butter in our specialty. And these are special molecules that use, a radionuclide and the pharmaceutical. But the pharmaceutical itself does not have a pharmaceutical effect on the human body. It's just used as a target. So you elect a target in the human body, a specific pathologic process, like cancer, for instance, cancer cells, and this is why it is so good in oncology. Mm-hmm. And if you have a molecule that has enough specificity for these, for these cancer cells, you can use it as a target. Mm-hmm. Okay. So our radiopharmaceuticals are using these targets, and then the radiation part, so the radionuclide part of the radiopharmaceutical emits a certain part or a certain type of radiation that would allow us to do either therapy or imaging based on the kind of radiation that it emits. So the principle is you inject the radiopharmaceutical to the patient, you wait for a little bit, and then using the radionuclide properties of the radiopharmaceutical, you would be able to localize with high precision where these tumor cells are within the body. So the other side of the nuclear medicine spectrum is the use of therapy. And for this, you use exactly the same molecule, so you know where the cancer cells are, and you know that they do express the target that you are using. Mm-hmm. So with this, you just switch the radionuclide. You start using a radionuclide that is highly ionizing, that kills cells. And with that, in that way, you can actually target very specifically cancer cells within the human body and destroy them.
So what was it in particular that motivated you to choose to specialize in nuclear medicine?
Mm-hmm. It wasn't something that was initially planned, because the specialty that I wanted to follow initially was neuroradiology. And this is actually the specialty that I did my master's in, my master's thesis. And so my tutor back then, which was the director of the department of neuroradiology at one of the biggest hospitals in Porto, he advised me to go to nuclear medicine because it's it was a specialty that was growing tremendously.
Yes.
And I had never considered it until that point. But I started looking at it. And yes, I was fortunate enough to catch this renaissance of nuclear medicine, really. Because for a long time, nuclear medicine was stagnant. There were no new techniques being developed, and the ones in place were being slowly replaced by other techniques, by radiology mostly. And it, as I had said before, it was mostly focused on diagnostics. And now with the development of new imaging techniques like PET-CT, but also most of all of these new molecules that really are revolutionizing the carrying cancer, they also allow us to treat different cancers that previously was just not possible.
Yeah. So why did you choose to relocate to the UAE? What was it that made you decide to start the process?
So it was both a personal and a professional decision. So as I had said, I was not feeling completely... I was feeling a bit frustrated back in Portugal because I felt like the opportunities to develop, to implement new techniques were quite limited. It was mostly focused on, just clinical day-to-day work. Within the possibilities, I wanted a country where the spoken language was English, for me just to adapt more quickly and more easily. And also with good weather, to mimic what I already had in Portugal. And of course, very important, with good opportunities for job growth. So I think that the UAE just fulfills all these parameters beautifully.
Perfect.
For my family as well, it's a very, very safe place.
Yes.
And again, regarding job opportunities, and the mentality here is for growth, for connecting to other people.
Yes, I love that.
So, it's just a very, very good place to be in.
Yeah. And why did you choose the Burjeel Medical City Hospital in particular?
So Burjeel Medical City, actually employed by Burjeel Cancer Institute, which is a part of Burjeel Medical City. And this was really a perfect job opportunity for me, because it's to be able to relocate from an oncology center back in Portugal to another oncology center and just take advantage of my expertise, my main areas of interest, which is basically diagnosis and treatment of cancer using radionuclides. It was just a perfect opportunity for me. And Burjeel Cancer Institute in specific it's really thriving to be one of the best, if not the best, cancer care provider in the UAE, and not only in the UAE but in the GCC region as well. Yeah. And we are very fortunate to have Professor Humaid Al-Shamsi, which is a very prominent figure in the UAE regarding cancer care. He's an Emirati, absolutely brilliant physician, and he's actually a celebrity here in the UAE as well. So that alone is a very, very big, a very big advantage for us, because we have a very big patient base, and he's the CEO of our institution. We are very fortunate to have him.
So you're being well supported.
Yes, absolutely. Yeah. And that nuclear medicine is basically, we are a specialty that provides services. So we don't build our own patient base.
Right.
We rely on our referring physicians to send us the patients. So we do need to be in a very dynamic, very high volume hospital in order to have work.
Yes.
Because we cannot go and fish these patients on our own. And so to have this solid foundation, patient foundation within the hospital itself, it's very, very big advantage for our department.
Do you have any opportunities to get involved in teaching or research in Burjeel Medical City, or is it something they're planning? Or?
Yes. So teaching, I'm not so sure about, but research, absolutely. At the moment, as I said, for these first months, we mostly focus on improving our department's workflow. But now that we are planning the next step to implement these new novel techniques, novel tracers, we definitely feel like there is an opportunity in Burjeel Medical City to be part of research projects. And this is a very good passion of mine as well, just to clinical research specifically. Back in Portugal, I fortunately had the opportunity to be involved in some clinical research projects. We mostly did projects regarding radionuclide therapy for neuroendocrine tumors, and we actually went ahead and presented this research in major international and national congresses. I won awards for this research back in Portugal,
I remember that,
and also international awards as well.
Wow.
So it was a very good opportunity that I had in Portugal to be able to deal with these innovative treatments so soon in my career. Also, when I was in Australia, I also had the opportunity to do some research with novel tracers that were back then not yet approved, so they were considered experimental. Nowadays, they are approved by the FDA, so they were quite a big success. At the time, it was really an amazing opportunity. And this paper that I published while I was in Australia, I think it's, as of today, it has 100 citations, which is quite a lot. And not only that, but it was also cited by international guidelines. So it had impact in patient care, you know.
Amazing.
So it was just amazing to be able to do that as early in my career. And it really did increase my awareness for the importance of clinical research and my passion for it as well. So it definitely is a goal of ours, because it's something that will help make sure that we are offering our patients the best care possible, and also it will have a great impact in projecting our department as well. So it's just, you know, something that will be natural for us once we have all these plans going on.
Absolutely. How was your experience working with Allocation Assist?
It was great. To be honest, I'm not just saying that because I'm here talking to you, but it was really an amazing experience. And this is something that I would definitely advise someone wanting to come and work in the UAE as a physician to get the proper help to do this, because it's not quite so easy. First, you have to comply with all the regulations, which is quite difficult, just to get your license approved, just to get the equivalency to your degree in medicine, and then to your specialty as well. And the second hurdle will be to secure a job here. And for that, the network that Allocation Assist has been able to secure, it's a great asset. And the fact that they not only help you coming here, but also to develop your career once you are here, it's a big plus. So, you know, just to have this opportunity, this help to achieve your goals is beautiful, and it is most helpful.
Thank you so much. Thank you, Goncalo. So good to see you.